Hi, everybody. My name is Gary Sather, and this is my TGCT or PVNS story. My story starts pretty much as far back as I can remember. I remember back in 2003, 2004, my right ankle had started to swell. I was really active back then. I thought it was just an injury that was stubborn to heal. In fact, a few years earlier, in the same ankle, I had been stung by a stingray on a beach in Mexico. I was really active. I ran a lot. I was into Muay Thai, did a lot of sports, a lot of hiking. So I really thought it was just something that wasn't healing on its own. I was a lot younger back then. I didn't have regular health care. So I didn't get it looked at, and I should have. That was kind of the start of my journey. Needless to say, I should have gone to the doctor sooner, but I didn't until actually about 2012. By that time, the tumor itself had grown quite large and was hindering my range of motion and my ability to walk, among other things. It was very noticeable. I actually went to the doctor for other medical unrelated issues. Um, and basically, in talking with my doctor about the other issues, he had seen my ankle and pretty much immediately backburnered my other issues and ordered an MRI of my ankle. He said, that's not normal. We need to have that looked at. And I'm glad he did. By that time, it was put on a fast track. The mass itself had grown to about the size of a grapefruit. Um, So the initial MRI had come back and they suspected diffuse type tenosynovial giant cell tumor. They immediately did a needle biopsy. They took 3 samples and it was guided under ultrasound. And 2 doctors looked at it there and said under the slides they, were sure it was diffuse type tenosynovial giant cell tumor. They sent it out to a lab just to confirm, but it was all confirmed. They knew enough to know that they didn't know enough. They referred me out of network to a Dr. Diong at OHSU in Portland, Oregon. I was living outside of Portland at the time. And she was a specialist an orthopedic oncologist who had some experience with the disease. She basically told me at that time radiation and drug options back then weren't really a heard of thing for this. So she basically just told me it was highly likely it was going to come back. She'd do the best job she could to get it out, but that she really recommended, with the size of it and the damage, that we amputate. I opted against that. So she did what she called a wide resection. She went in and made incisions on both sides of my leg and took out everything that she could get. And actually, it did a pretty good job. I mean, recovery road was a long time. It was months and months. It was a good few months before I was able to be weight bearing again. I used a cane for quite a while. Um, I only stopped using the cane because it was too frustrating dropping it every time I turned around. But the issues I had were from, I think, the surgery and the damage. My ankle would then continue to buckle and give out on me, and there was always residual pain. Whether that was the disease or just consequences of surgery, I don't know. But it did tend to keep it away. There were some other things they did. They used a drain tube to drain fluid off, and a nerve block. I think one thing I could say to some other folks is look into a nerve block if you have to have any kind of surgery. It was better than pain medicine. It applied, it's kind of like Novocaine going right on your nerve, whatever it is that they use, but it was good. But I healed as best as I could, and it actually did a good job. It stayed away until about 2020. Was when I noticed my ankle starting to swell up again, and I knew it wasn't quite right. Only this time I had some insurance again, and I was not backburnering it this time, not like the last time. I had some other medical issues going on again, unrelated, but I had my primary look at it. They did an MRI, and they did confirm in the MRI recurrence of diffuse type tenosynovial giant cell tumor, or PVNS. I've heard it go by both this time. The first time around, I never really heard PVNS, just TGCT. Anyways, so this time around, they had to refer me back out of network again to a doctor at Providence, and he basically said that he wanted to do surgery first because I have bone damage this time. My tumor's in the same area, but instead of being on the outside of my of the muscles and ligaments and stuff there, it was more between the ligaments and the bone, and it was eroding at my bone. But that this time there was also an option. We talked about amputation again, but he said this time there was an option to try the Turalio after surgery to keep it away and to keep it from coming back. And I thought that was great. The only problem was we found ourselves in the middle of a COVID pandemic, and they could not schedule neither my surgery nor get me lined up with oncology for the Turalio in my area. It was about that time that I got really angry. It's one thing to be told, you know, it's got to come off, or here's what has to happen. It's another thing to be told, hey, there's options here, but we just can't do them because there's a pandemic that's entirely unrelated, and they consider your issues to be elective, non-essential, making it sound like it was my choice to deal with this so much as I have a disease and it needs taken care of. That was probably the hardest part out of everything. I don't think any words effectively express how angry it made me. Needless to say, there wasn't anything I could do about it. The news actually picked up my story at about the same time I simultaneously had tripped across the TGCT support groups. I was using it as an avenue to both vent, my frustrations and find comfort and peers that were there and people that were going through the same thing. Through that, Sydney Stern had picked up my story and ran with it and got me referred into Seattle Cancer Care Alliance, which is a few hours away from where I live, with Dr. Wagner and his care team there. Great team to work with. I was able to get on with them and talk with them and their surgeon. It was a little bittersweet because the surgeon kind of felt that it indeed had been too long in waiting and the postponement and the bone damage that I had. He felt that the Turalio wouldn't be an option because of the damage that had already been done, whereas Dr. Wagner himself felt, maybe even just if they could shrink the tumor and maybe reduce the pressure, that would be enough to improve quality of life and to keep the foot. So between the two of them, I agreed, I'd give Turalio a 6-month go and see how it works out. So I'm about 3 months in now, and the current status is the swelling is definitely down. 100%. The swelling is down. Now, whether or not that means it's shrinking the tumor, I don't know. I've got my first follow-up imaging scheduled here in the next couple weeks. And I'll find out if it's actually shrinking the tumor. But unfortunately, I think it's doing what it's supposed to do, but I think we're erring on the side that my surgeon might have been right because I actually have more pain now. The theory behind that is that in reducing the swelling, we may have reduced somewhat of the buffer that was, the swelling was in itself trying to help keep pressure and lubricate things down there and helped with some of the pain. Whereas now with that swelling down, it seems like I might maybe have more pressure on the bone. I don't know that it's really hurting more so much as it's different than the pain I've had for the past how many years in dealing with it. My body isn't adjusted to it. It's hard to say, but your body reaches a point with pain where it just becomes numb to it and you're used to a 6 or a 7. And now it's a different kind of pain. It might only be a 5, but it's different. So in my mind, it hurts more now. But I do feel like Turalio is doing its job. So I'm hoping, I'm still hopeful that over the next few months, maybe there will be some healing down there that allows that pain to diminish and maybe it will improve quality of life. But nonetheless, I'm prepared that if it doesn't, it may be in my case, amputation is the way to go, and I'm prepared for that. Um, Basically, because it's guaranteed there'd be no more of the Turalio, the chemo. It's guaranteed, there's no more recurrences because it doesn't really spread to other joints. It would be really, really, really rare. So basically, this eliminates any chance of recurrence. I don't have to be on the chemo, which has its own side effects. Basically, just learn how to walk on a prosthetic again and be done with it and move on with my life. So it might really be the way to go, and mentally I'm prepared for that. I feel like the hardest part with TGCT was the lifestyle changes, the change in range of motion and mobility, because I went from being really active, I was diving all the time, I was in Muay Thai, and things that, required the use of my legs and my ankles, and going on to walking with a cane and having that limitation put on me was really hard physically and mentally. Uh, Mentally almost harder than the physical aspects of it. But I think the harder thing wasn't even the TGCT itself. It was being told that, hey, there's options, but we can't schedule them because of a pandemic, and that they considered it to be elective and non-essential. I think that's, having any disease, especially having to deal with a rare disease, I think that's a lot to take in. But that's where TGCT support stepped up. That's not only did it help get me into treatment when I otherwise couldn't, but it gave me an outlet and a network of people to relate to and converse with. And within that network, I was able to learn about, the potential benefits of the Turalio, and to get information and to share information, and also how amputation, if it comes down to it, it wouldn't be an end or some dramatic bad experience, but a new beginning, a beginning some people don't have. They don't have the option because their TGCT or PVNS is in an inoperable joint, whereas mine, they could operate. It's more destructive at this point to keep doing operations, but they can operate and amputate if needed. It's a lot harder to, amputate a hip than it would be to amputate my foot. So no feeling sorry for myself out of any of that, but feeling lucky to even just have an option, that a lot of other people might not have. It is an option, whether I like it or not, and it's a chance to move on and move forward. So in a nutshell, the most condensed version I think I can give, that's my story. And if I could give any information to anyone else, it is to use the group. It is a great tool. Use the TGCT groups and forums and network with your peers. You're not alone. You're never alone in this process, even though it is rare. There are people who have been through it, who are going through it, who understand and have been there too. And there are better days. I think that's about it to my story. And as far as the better day goes, I'm still waiting for mine, and I hope you find yours. And I'm glad to help and just have a network of my peers to share and grow with. And thank you for listening to my story.